people you may not approve. It may not be something you would do for you, but can you put yourself in the shoes of the person who does need an abortion? And can you understand that and not prevent that from happening? And it was incredibly brave and courageous of women and couples to stand up, and it was deeply moving. And we do know that in campaigns, in voting, people vote from their hearts. They want the arguments to their heads, but they vote from their hearts. I think it's here. That's where we vote from always. So some of our wonderful, wonderful, wonderful campaigners. And as you know, 66.4%, what could be better?
National Action Plan, we want to actually implement it in 2020, and we hope to work with other organizations. And this is World Bank actually promised that they will support, but still there is a long way to go, because the federal government of Somalia should adopt this. Shouldn't be us, because this is the young women in Somalia that we are protecting, and they are the people who should take in their own hand. But World Bank promised they will actually support if the Somali government take this. But we have a crisis in Somalia, and it's not easy. But that doesn't actually discourage me to say I'm not going to do this work, because still there are many young women who are facing on the consequence of female genital mutilation, that and all others, and there's something we can do.
The last thing that David Sanders published was in The Lancet 2 weeks ago, the week before he died, and it was about primary health care, revisiting the idea of when primary health care was described in 1978 in Almaty. It was about universal accessibility, about comprehensive care, about community involvement and self-reliance, about intersectoral action, about appropriate technology. You've all heard this before. It was revisited in Astana then at the end of last year, the Declaration of Astana, to push primary health care, but the stress on the comprehensiveness and on community involvement and on the determinants of health has been watered down a little bit. So we need to think about what that means. There's also the conference that's on, or the meeting in the UN the week after next about universal health coverage. It's not universal health care. It's focusing primarily on financial protection. So that message that David Sanders had recently was about primary health care should be the umbrella overseeing all of this, not just something in the corner around it or something that's underpinning it.
What was our lesson learned, and what we have messaged also today, like one of the developing countries. So our lesson learned is community engagement. Unfortunately, in many developing countries, when donor is funding, the budget is kind of conditional budget. If we follow the international rule, we will be able to get the fund from the international donors. If not, then we may not be able to do it. So that's why local community is somehow neglected. I remember we had one project, they were focusing on HIV, the other project was focusing on TB, the third one was focusing on malaria. It was not well integrated. So if health system is not integrated, then 75% we are dependent on foreign aid for the future. We may also get to 90% because people are not well controlled. So the last thing, health system was also somehow, still it is one of the biggest challenges that we have, it is fragmented. Because several partners in several provinces, so these partners, different partners in different provinces, it's difficult to bring them together because sometimes they got project directly from Geneva. Even the government of Afghanistan is not in the picture, then how they could be accountable to us. So that will be something that we want to discuss it in our meeting also with the donors.